Hi, a very good morning to doctor. My name is KERK with matrix number 240060035. And here with my teammate TEOH, CHENG, and NURADRIANA. We're going to present about what is a leg brace to give people a brief understanding on the theory behind it. Alright, so without further ado, let me do a brief introduction on the content of our video. First of all, I'll do a brief introduction on what is leg brace support and what is walking and the biomechanics concept and theory behind it. And then there'll be a problem statements on various type of leg brace support. And then Adriana will be explain what is leg brace in a more detailed way and how it works on our body. And then TECK will be continue with the impact of the leg braces on our daily life and society, and what is the limitation of current leg brace support in the market, and what is the improvement that can be done to make the current leg brace support to be better and help more people. And then we will end the presentation with a short conclusion. Alright, so before we go into what is walking and the theory behind it, we need to understand what is the leg support brace and why we use it for rehabilitation use. So, leg support brace is a medical device for support and alignment. It supports the muscle and joints activity, especially it's very useful for injury recovery or chronic conditions such as muscle weakness and joint instability. So it will reduce the stress exerted on our joint and enhance the stability of our lower parts, lower limbs. So there are three types of leg support brace currently in the market. First of all is knee support brace, and then hip, knee, ankle, foot orthotics, ankle, foot orthotics. So next I will explain what is walking and the theory behind it. Okay, walking seems very simple, but it's actually a very complex process that is made of two phases. One is stance and one is swing. So let's take a look at the picture. So the right leg is highlighted with black colored. So we'll focus on the right leg itself. Okay, so first of all, on the first 60%, the right leg will carry out stance phase. So you can see at the pictures, the right foot will land on the ground and then we flatten our right foot. And then meanwhile, the other leg is trying to move forward. So we need to stabilize our body by shifting our weight onto the right foot. Okay, so after it successfully strike forward, we need to stabilize our body, and then the right foot will again lift the toes up for the next phase, which is swing phase, where the foot is off the ground and you kick your leg forward. So that makes up walking. So the process will repeat over and over again, and that's how we walk. Okay, now that we understand what is walking, we want to know what is the role of musculoskeletal system in walking. So, musculoskeletal system are made up of bone, joints, muscle, and tendon and ligament. So, first of all, we look at what is bone. So, bones are very hard structures that give our body a shape and support. So, for example, the femur, which is thigh bone, will act like a levers to help us move our leg forward and support our weight. So secondly, joints. Joints are where two bones meet each other and then they will let the bones to move smoothly. For example, the hip joints will help to lift and swing the leg. So the third one is muscles. Muscles are very soft tissues that pull on the bones to create movement. For example, it's the quadriceps, which is the muscles on front thigh. They will help us to straighten the knee. So lastly is tendons and ligaments. So tendons connect muscle to bone and ligaments connect bone to bone. So for example, the knee ligament will keep the knee from moving in a wrong way, especially during turns or during walking. Thank you. That's all for my parts.
Hi, Doctor. I'm Jason Chan. Now, I'm going to discuss about the problem statement of leg surgeries. The first one is SCL injury. The SCL is one of the main ligaments stabilizing the knee. It causes knee instability and pain. Hence, we need to wear knee support brace to prevent excessive twisting or forward tibial movement. The next is foot block. Foot drop cause the toe to drag on the ground when walking. So we need to wear the ankle foot orthosis to hold the foot in a neutral position so it clears the ground during the swing phase. The third is spinal cord injuries. Spinal cord injuries can lead to paralysis or weakness in the hip and leg. Patients with paralysis need to wear hip, knee, ankle, foot orthosis to provide structural support for standing and walking. The last one is meniscus tear. Meniscus is torn due to twisting or impact injuries. Hence, patients need to wear knee support brace to protect meniscus during healing or post-surgery.
Have you ever seen someone walking just a little slower than everyone else? Not because they are lazy, but because every step requires effort and also balance. For many people that are recovering from injuries, surgeries, or dealing with muscle weakness, walking is no longer a reflex. It's a challenge, and this is where leg brace support silently step in. A leg brace doesn't just support the leg, it gives people a chance to stand with confidence, to move without fear, and to reclaim a sense of independence they might have lost. Behind this simple looking tool is a clever balance of rigidity and flexibility. It has to be strong enough to support joints, yet gentle enough to allow movement. It works closely with the body and not against it. What's more impressive is how customizable these braces can be. Some are lightweight for daily use, some are designed for sports, and newer ones even come with smart pressure adjustment and shock absorbing technology to protect the knee or ankle during the impact. And for sure, by using leg brace support, children that born with muscular condition, athlete recovering from ACL injuries, or elderly individual may regain their own stability. Now, let's talk about how a leg brace actually works and what it does to help the body heal better and move safer. First, it helps control the range of motion. After an injury or surgery, the joint needs time to recover without being pushed too far. A leg brace limits how much the knee or ankle can bend or stretch to make sure the movements stay within a safe zone. Next, it works to reduce pain and swelling. With just the right amount of compression, the brace can help to calm inflammation and offers better comfort, especially in the first few days of healing when every step can feel intense. And lastly, the brace functions to stabilize the joint. It keeps the leg aligned and steady, so there's less unwanted movement. This stability not only prevents further injury, but also gives the body the support it needs to heal properly.
Furthermore, here are some of the pictures that help us to have a better understanding about what are SEO injuries, foot drop, impairment, and meniscus tears.
Hi, my name is TEOH, matrix number 240502236, and now I'm going to talk about the impact of leg braces on daily life and society. The first is that it helps to improve mobility and independence. Leg braces support weaken muscles and it helps to stabilize joints and correct abnormal walking patterns. For individuals with musculoskeletal conditions such as cerebral palsy, polio, or they're recovering from a stroke, a leg brace can help enhance their ability to walk safely and confidently. This promotes greater independence in daily activities such as going to school and work, and students don't need to depend on their parents to fetch them, or working adults can function on their own. The second one is pain reduction and injury prevention. By aligning the joints and relieving pressure from overstressed muscles or ligaments, leg braces help to reduce pain and minimize the risk of further injuries. This is especially beneficial for people with knee instability, such as certain athletes, or post-operative recovery or chronic joint conditions. As you can see in the picture, a leg brace can help to support an athlete while they are training for an upcoming competition, and it helps the athlete to able to function better and perform in their sports. Next, furthermore, we are going to cover the psychological effects. While leg braces may offer physical benefits, as shown in the first slide, wearing them also may affect a person's self-esteem or social comfort, especially for children or teenagers. They might not want to be seen around their peers wearing crutches, but wearing a leg brace helps to ensure that it's more hidden and they might not be bullied in school because of wearing a leg brace. Next is economic and healthcare impact. By reducing the need for surgeries or hospital stays or long-term medication or care from another individual, leg braces can lower healthcare costs, and students now can still participate in education without any further difficulty. The last is the technological advancement in biomedical devices. Modern leg braces have paved the way into improving the biomedical field. It has evolved from rigid, bulky devices to lightweight, dynamic materials. Innovations focus on improving function, comfort, and adaptability, making leg braces more effective and user friendly. This has helped improve the field in innovating other biomedical devices.
Then, I'm going to present about the limitation of leg support brace. The first is limited natural movement. This brace often restricts joint movement to provide stability, but this can interfere with the natural biomechanics of walking, making the user's gait look or feel stiff and unnatural. The second is discomfort and skin irritation. Discomfort and skin irritation can occur when leg brace apply constant pressure on certain areas of the skin, especially during long period of use. The third is leg support brace can lead to muscle atrophy. The leg support brace takes over the job of stabilizing and moving the limb. The surrounding muscle may become less active, leading to reduced strength and endurance. Last but not least is heavy or bulky design. Some leg braces are large, thick, or made from heavy materials, which can make them uncomfortable to wear for long periods. This extra weight may cause tiredness and can also discourage user from wearing the brace regularly. Here are some of the improvements we can implement to overcome the limitation. The first one is we can use 3D printer custom brace. It is because they are made using body scan to match the shape of the user's leg. This helps the brace fit better, feel more comfortable, and support more natural movement when walking. The next is to prevent muscle weakening. Users should do regular exercise and physical therapy while using the brace. Choosing dynamic or hinge brands that allow some movement can also help engage the muscle during walking. The third, to prevent discomfort and skin problem, brace should use soft, breathable material to reduce pressure and sweating. Making sure the brace fit well help avoid rubbing and sore spot. The last is heavy or bulky design. To fix the problem of heavy brace, we can use the lighter material like carbon fiber or plastic. Make the brace thinner and smaller, also make it more comfortable and easier to wear. That's all for me. Thank you.
Lastly is the conclusion. The leg brace is a vital assistive device that supports the human musculoskeletal system, and it's very important. It includes the bones, muscles, joints, and connective tissues. When any part of this system is impaired, it affects our posture, balance, and mobility, and affects our day-to-day daily activities. Leg braces help to compensate for those dysfunctions by providing mechanical support, alignment, and functional stability, allowing the musculoskeletal system to operate more efficiently or recover from injury. In essence, leg braces serve as an external aid that helps restore natural movement and improve quality of life, bridging the gap between disability and independence in both personal and other daily life.